Hello, this is Socially Triggered, and this video is going to be on healthcare and the problems with healthcare. I want to give a little bit of full disclosure on this because I am slightly biased in the regard to healthcare, and my biases lie in several places. One, I'm Canadian, so I'm used to what it is like to be under a universal healthcare system. And the other issue for me is I'm the son of two doctors. My grandfather was even a doctor. My whole lineage is like lots of doctors in my family. I'm sort of the black sheep of my family. I'm the business person, and the rest of my family are doctors. So it's kind of a weird situation where I'm always propagandized by my parents who complain about the healthcare system in Canada and the problems with healthcare system. And I just hear story after story about all the issues with healthcare. So I know it from that aspect where they as doctors, they complain about the issues that Canadian healthcare system have. Um, the other thing that I have to be open about is I'm very athletic, or I was. Um, I was involved with judo, and judo is one of those sports where if you take it, you'll understand this. But it's one of those ones where you get injured a lot, and I've had several serious injuries where I had to depend on healthcare for basically dealing with the damage that I did to myself. So those are the three biases that I have. I have parents that are in the industry. I have this bias of being Canadian and experiencing what the universal healthcare system is like. And I have the bias of having needed and depended on this healthcare. So these are these are my biases. And from that bias, I'd like to say that I believe that everybody should have access to healthcare and to the best quality healthcare. Now, what a universal system does is it actually prevents that exact thing. Um, One of the things that we believe is that, oh, if we have a universal healthcare, everybody will have access to healthcare. And that is just not the case. We all have access to some healthcare and we have access to equal levels of that some healthcare, but we don't have access to healthcare. And I'll explain the difference in that. So in a system that's controlled by the government, you have a limitation, a cap, how much money can be spent. And it based on how much tax money that they can generate to pay for healthcare. And there's only so much you can tax people. It's one of those things where you can, if you start taxing them too much, well, they stop eating. They run out of money. So there's only so much money you can tax. Okay, and we actually tax. I think it's like 20 or 30%. I think it's maybe even 30, 40% of our healthcare of our budget is devoted to healthcare. It's quite a large percentage of our national budget is devoted to healthcare. And you could say, well, why not expand it to 100% of our budget? Well, then you wouldn't have all these other services that we depend on, right? Like education and so forth. Um, so there's only a certain amount of money. Whenever there's a government system, there's always a cap to how much money you can spend on it. However, healthcare is one of those interesting things which has no cap in terms of what the demand might be. And I'll explain this in a way. Let's say you go your whole life without being sick. Well, then you really don't have much demand on healthcare. But that's very rarely the case. We generally get sick. We have different issues with our lives. We get the broken arm or the cold that makes us sick, and we have different things that make us depend on healthcare. And there are some people who are different than others. Well, this might be shocking, but when you have a universal system, you have to treat everybody as being the same, right? But the problem is we aren't the same. And because we're not the same, we have different demands that we make on the system. Some people need lots of healthcare. Some people need very little. And because of that, what ends up happening is the ones that require very little healthcare end up paying for the healthcare of the ones who need a lot, and are limited by the ones who need a lot of healthcare. Because the ones that need a lot of healthcare are putting that strain on the system because they're not fitting into that round hole that the government wants you to put in. And if you put a square peg in there, well, it's not going to work. So the point is the government expects universality of humans. We are all equal, but we're not. So it basically breaks the system because you have these people who require more health care than others. And I actually have no problem with that, but it is a problem for the system. Now, imagine you only have a certain amount of money that you can spend on healthcare, and you have a demand that could be infinite. Well, what ends up happening is that you hit that limit, and then you have to say, well, we can't provide any more. There's no money. Okay, we have to deal in reality, people. So when people say we want to provide universal health care, realize that there's a limit to how much can be spent. There's not infinite money that can be spent. So, well, let's look at healthcare. Well, if you go back 100 years, the healthcare that you could provide was very basic. A lot of people died from very common things that we would, have no problem surviving nowadays with. We didn't have very complicated surgeries back then, and healthcare was relatively inexpensive. Generally, if you got something serious, you died, and in a way, that cost was very minimal. Okay, so because they'd be like, okay, well, sorry, you're going to die. You're terminal. And the same happens now with certain types of cancer. They say, well, you have terminal cancer. You maybe only have like a certain number of days to live when you have this diagnosis. But we are constantly improving, and we get better systems, and we get better drugs, and we get better procedures that we can use to cure those ailments, and they cost money. So what happens is things that normally would have killed us and reduced the cost of that healthcare now have new treatments that cost a lot because they're relatively new. And when things are new, they are usually fairly expensive. I give you a good example of this. Going back maybe 10, 15 years ago, I saw the very first flat screen TV. And the flat screen TV cost $14,000 and was only 14 inches. It was this big. Okay, so $14,000 for it. And I thought, who would ever buy this? But somebody did. Some people did, because those initial people to buy that new technology were the ones that helped to bring down the cost. As companies, saw this demand of, selling these really expensive flat screen TVs, well, they were able to produce more of it. And when you produce more of it, you can reduce the costs because volume can reduce costs. So the same happens with medical care. Some of these new treatments are very expensive at the beginning, but can over time come down in cost because they develop methods for reducing those costs. So, but the problem is there's always that initial cost. And with healthcare, we're dealing with always these new experimental drugs, new experimental procedures. We're dealing with doctors who require a huge amount of training to learn these new procedures, and it becomes very, very expensive. So what we have is we have a thing where the cost could be infinite, but the pool of money that we can use towards that infinite care is limited. So there's a real dilemma there. Well, how do you provide equal access to everybody, that everybody should get whatever procedure they want covered by the government, if that cost is just unimaginable, where it just can't be afforded by the system? It just doesn't work. So what you have to have is you have to have a system which relies on two methods. One, You say, okay, if you want this additional service, then you have to pay for it because the system can't pay for it. Okay, this is the only way it can work because eventually you'll hit that cap and all these additional things will not be covered. So either you force people to pay for it, or you take money out of the system that was normally used for treating many people, and you assign it to treating very few people. And this has been something that's been happening in Canada, where what happens is the people that require, we triage, right? The ones that need this most serious treatment, most serious, like the ones that are like going to die, we treat first because they're going to die. And they require a huge amount of healthcare, huge amount of costs. But we triage it and say, okay, well, they need the help now. These minor things, well, they can wait, they can be delayed. And that's what ends up happening. So what ends up happening is waiting lists become longer because the resources are being split between these two competing forces. The demand for the resources is not evenly distributed between the individuals within those groups. Okay, so what happens is one person requires 1,000 times more resources than the other people, and they basically siphon away the money from the system that would treat those other people. So those other people have to either wait or not get the care at all. And that's a reality of like a governmental system that is limited in terms of how much money it can devote to these treatments. The other possibility, and this happens as well in Canada, it's really brutal, is these experimental procedures that have been shown to work are not covered at all. The government says, well, we won't cover them and we will actually outlaw them. They won't allow it in Canada, certain procedures. There's certain ones that will treat the spine that have been shown to allow people who got paralyzed to actually be able to walk again. And those procedures are being outlawed in Canada because the government's like, well, we can't afford that. Like, you know, this guy walking or, is maybe not valuable enough for our society compared to the 100 people that could be paid for to be healthy that could be more beneficial to society. So that's the government decision that they choose for you where the resources should be spent. And that's what often happens. So that kills innovation. So no new technologies are not becoming available as quickly. And it actually reduces the quality of people's healthcare. So we have these two issues. Either we have the system where the government says, okay, we will just block these new technologies, or we have the system where they say, okay, we'll allow the new technologies, but you have to pay for them as an individual. So the government is basically saying, well, we need the two-tier system. We need the free market to take over because the only way you can get those new treatments within the system that we have is if you pay for them. And that, to me, is very fair. That the government, I really wish it would be not involved at all. I would actually like to see it totally free market, and our tax money could be used to, we're paying thousands of dollars per year. That money could easily be put aside where we could use it towards a health insurance or, where we get covered for potential future care. But the government won't let us do that kind of thing. So they have a monopoly on the system, and monopolies are, as you know, very bad system. So having a government monopoly is even worse. So what ends up happening is people don't have access to a lot of the treatments that they would want. Or what also happens within the Canadian system is you have people who are dying just waiting for the treatment. And what they do, as I said, if they only have a cap on how much money that they can spend, well, if the demand is high and the supply is low, what they do is they say, okay, those who are demanding this service, wait, just wait, we'll get to you eventually. and usually they don't get to you. they, you wait and wait, and you don't actually get the treatment, or when you get it, it's pretty late in the whole game. So what ends up happening is in Canada, we have about 2 times the death rate of people waiting for healthcare as people in the US who die from not being able to afford healthcare. So many more people die in Canada just waiting to get treatment than people that die because they just can't afford it in the United States. So, in my opinion, that's unfair. I would rather a system where if we want to pay for healthcare, we can go to a private center and pay for that healthcare. Why should I die just because the system says it has to be universal? Even if I was poor, I'd want this because I would say, okay, I'm poor, I can't afford this health care that could save my life, but at least I can do what maybe I can talk to my friends, my neighbors, and raise money to pay for that surgery or pay for that health care that I couldn't afford. And I'd had that option. But in the system that we have in Canada right now, where it's universal healthcare, there is no other option. You only have the government system. You're not allowed to go to some secondary system. So that to me is very, very unfair. And you see this in the United States where they're promising, especially the Democrats, they're promising universal health care. And all that will do is create a cap to how much they will spend on healthcare because they have to stay within a financial, there's only so much money within a government system. And once you create a cap, then services will get limited. And when services get limited, people start dying, people start having unhealthier lives, and they don't have the freedom to live, to choose what their healthcare should be. So what I'm telling you, what I'm trying to express here is a very simple idea that healthcare can either be universal and bad or unfair in terms of equality. Like it can be free market where it's going to be uneven distribution, but really, really good in terms of the quality of healthcare that's available. And the access within both of those systems, and under the universal system, everybody has equal access to really bad care. Or in a private system or in a free market system, everybody has equal access as long as you can afford it. And that I know that's unfair in some ways. People say, well, not everybody has the same amount of resources. But what happens is if you don't do that, the result is that people get really bad healthcare under the other system. It's just like everything else under socialism. You get what you put into it. Like I mean, the government systems when it's socialized, it is historically bad. It just doesn't go very well for the people that are under it. We're not eating rats yet, but they're beginning to look fairly good. Okay, so that's the life under socialist policies. That what happens is people begin to suffer because the system collapses under its own demands, that it just can't cover everybody and it can't treat everybody equally. Um, and I'd even have to get into the abuse of the system. Like, that's not even an issue compared to all these other things where it just, healthcare is constantly going to be more and more and more expensive. And the only way that we can pay for those more and more expensive treatments is to remove the cost from somewhere else. I gave you an example of the treatment for paralysis where people can't walk. And there's a treatment for it where you can put what's called a stent into the person's spine, and it can act as a transmitter of the signal across the spinal cord. And that treatment is available in other countries. but it's illegal in Canada. And the government always tries to come up with some excuse to make it, why they made it illegal. Um, the other thing that happens is, so that's as I said, they really do limit innovation and the ability to people to get more and more sophisticated healthcare. But also what happens is we have things like universal healthcare really isn't universal, even in Canada, where dental and pharmacy are not covered. And those are essential to human health. Now, there's talk in Canada to make those also covered by the government. And I think, wow, more things that we're going to have to wait more and more time to get, and more people are going to die waiting for things that they would normally be able to pay for and just get. And generally, what happens is when government takes over, they don't really understand cost. This is one of the biggest complaints of my parents. And just so you understand, as I said, they're both doctors. One of the complaints that they have is they don't set their own fees. So the government bureaucrat who doesn't maybe understand medicine very well or doesn't understand the demands within medicine is setting the fees for a procedure. Now, they might have some medical knowledge, but they might not understand the different demands within those medical practices. So basically they're setting the fees. They're saying, well, this fee is this service costs this much. And the doctor has no choice but to charge that much. Or they don't charge the patient, they charge the government for that service, providing that service. And what ends up happening is often the government sets numbers that are just not realistic. It might cost the doctor more to provide the service than the government is willing to pay for that service. So because the doctor can't set their own fees, they basically don't have that ability to wage how much something is worth. And sometimes things are set very high, where the doctor can make lots and lots of money at it, and then some things are set so low that they can't make any money at it. So what ends up happening is the government basically forces doctors to choose which services they're going to provide based on how much they're willing to compensate that doctor. So doctors will end up going for providing services that have a higher price tag associated with them so that they can just pay for the cost of that service. And what ends up happening is sometimes services that might be better are not being utilized because the doctors just can't make any money doing those services. So that's a real issue. The doctors should be able to set their own fees. And under a government system, that's not able, they just don't have that freedom. Another kind of crazy issue within the government system is that not only doctors have to pay huge amounts of money to become a doctor and stuff and get all this training, but they can't really set their fees in terms of how much they are worth. So if you have two doctors performing the same service, okay, they're both doing this very same procedure. One doctor might have 20, 30 years of experience, might be very, very good at it. And the other could be like some new rookie that just doesn't have the experience, doesn't know even, is very, maybe not even an adequate doctor, and they just don't know how to perform the service that well. Well, under the government system, they both charge the same fee. So you're basically, you're spinning the roulette wheel when you go to a doctor because you hope that they have the skill and they're really good at that procedure or really good at that diagnosis. And you're never sure, but you're paying the same cost regardless. And that's the problem. Like normally, if somebody's really good at something, they can charge a bit more for that service. And when doctors can set their own fees, they can basically say, well, I'm better at this service. I can do it more efficiently. I can do it, with greater results. I should be allowed to charge more. But under a government system, you can't. And that's a real problem. So there's all these kind of weird issues that form under a socialized government-controlled healthcare system. And it really does break down the system when you think about it. So one of the things that you really have to understand, and this is just if you don't catch any of the other stuff that I babbled about, this is the basic understanding that you have to achieve from this. Whenever you have universal healthcare, there's always a cap on how much money can be spent, how much money can be devoted to it. And if there is infinite potential demand, that cap will always be reached and exceeded. And as a result, that cap will be the death nail to that service. It will just overwhelm the service. So eventually healthcare will collapse. It's just a matter of when. And there's all these fudging things that the government tried to do to prevent the systems from collapsing. They limit the number of doctors. They limit the number of nurses. They limit the number of beds in hospitals. They limit they provide worse and worse healthcare in order to basically cater to the fact that they know that the system is broken. One of the funny things is I remember this when way back when, like 20, 30 years ago, I went to the hospital and I was like so annoyed. I had to wait like 2 hours to go to the hospital. This is like 30 years ago. And I was waiting for like 2 hours. I was like, oh, this is so slow. Then 10 years forward of that, I went to the hospital. I was in the emergency room for something serious, actually. And I had to wait 3 hours to see a doctor. Now, when I go to the hospital, I might wait 6 to 10 hours to see a doctor. And it's just insane that you have to wait that long for potentially an emergency. But that's the system. It's a broken system. And the only way that they can solve it as the demands get higher is to provide worse and worse coverage, worse and worse system. And there's no way under a government system that you can avoid that. I don't blame the system. It is what it is. It's limited by its own resources, and it's only going to get worse. So this has been Socially Triggered. I hope you enjoyed this video. I hope you understand the dangers of universal healthcare from this. I'd like to hear your feedback, and I'd also like to ask you for ideas for future videos that I do. If you watch my videos, like I talk about a range of issues, and often I talk about things that have triggered me. That's why I call it Socially Triggered, because it's things that, oh my goodness, I can't believe that this is still being talked about. I can't believe people think this way. And I get triggered and I want to talk about it and I make a video about it. So I'd love to hear what triggers you, and leave that in the comments. And if you have good questions that will also trigger me, I will do a video about it. I like especially topics about capitalism and socialism. I love those kind of topics. I like the identity politics stuff because I like making fun of them. I love all this kind of stuff. It's interesting to me. So I hope you enjoyed this video. Please like, comment, and subscribe, and check out my other videos. Thanks.